weird that we are using a microphone in such a small group, but kind of some rules of the game is every time we do talk, we have to use a microphone because this is being recorded and will be out on YouTube later for everybody to view. So you will now be a YouTube star. So to get us started, Dr. Medford, our Deputy Superintendent, would like to say a few words to get us going.
Thank you. I won't take too long. I know you guys have lots of business. I just wanted to say welcome and thank you. I know just getting here for some of you is a long trek, so we appreciate the time that you spend not only getting here, but being with us as we travel through a year of really important topics and really important things to the kids, families, teachers, staff in our district. So we really, really appreciate you. We have a whole group of people here to support you. You guys are the committee. You guys do the work, and we are here to support whatever it is you need. So please reach out to us if there's anything we can ever do to help support you. But again, thank you.
All right, fantastic. Well, before we begin, we're going to make sure everybody knows who's in the room and participating in SHAC this year. So if you could just introduce yourself and tell us who you're representing, what group you're representing, or if you're a staff member, what your current assignment is. To work the mics, you just have to tap the button and it'll turn green. Once it turns green, it is live. So if we could, Dr. Todd, would you start us off, please?
Good afternoon, my name is Carlton Todd. I am the principal of Stockton Junior High. This is my 10th year in the district.
Good afternoon, this is Sabrina Yamani and I'm a parent with the Woodlands Feeder.
Hi, I'm Jennifer Blackman and I'm a parent with the College Park Feeder.
I'm Susan O'Neill. I'm a pediatrician in the area, and I have 3 kids that came all the way through CISD.
Good afternoon. I'm Lindsay Massey, and I'm a parent of the Grand Oaks Feeder.
I'm Shannon Hall, and I'm a health science teacher at College Park.
My name is Brent Maddox, and I'm a parent in the Woodlands Feeder.
Holly Moore, parent in the Grand Oaks Feeder. It's been a long day.
Ryan Samoris, parent, Grand Oaks Feeder.
Janice Lovelace, crisis intervention specialist with the district.
Ashley Heinen, parent of the Woodlands Feeder.
We also have a great group over here that is here to support us and to advise us on all the information within their departments in the district. So we're going to pass the mic here so you know who's over here.
Wade Haymark, coordinator of PE and Health.
Chris Povich, assistant superintendent for high schools.
Lindsay Taylor, the mental health specialist.
Barbara Robertson, director of health services.
Robin Hughes, Director of Child Nutrition.
Chris McCord, Assistant Superintendent of Operations.
Tiffany Rodriguez, Coordinator of Guidance and Counseling.
Tamika Taylor, Assistant Superintendent of Student Support Services.
Matt Blakelock, Chief of Police.
Shelley Winkler, Assistant Superintendent for Elementary Schools.
Sarah Blakelock, Director of Communications.
I'm Aditya Sada Upshaw, the Assistant Superintendent of Teaching and Learning.
Okay, so the first part of our business today is to find out what SHAC is, what we're here for. And so I asked Dr. Upshaw to kind of give us an overview. She is very experienced with SHAC and knows kind of all the rules and laws and all that involving SHAC. So she's going to cover that for us.
Thank you, Dr. Merle. So I'm going to go over just the main tenets of what the SHAC does, and I imagine as we evolve through the work throughout this school year and reflect on the work that was done last year by our SHAC, we can dive in deeper to what these things and components mean in our school district. Like today, one of the things that the SHAC assists us with is on the wellness plan, so on and so forth. So I can see us as we evolve into those meetings throughout the year, you'll be able to learn more in depth of what these components entail. I'm here to just give you a brief overview of what the SHAC does in our school district. or what it does in general in the state of Texas. So what is the SHAC? So the board establishes what we call a school health advisory council, and it assists the district in making decisions about 8 to 10 huge topics, right? And they are to our parents and our communities, whether they're members of the community, teachers of the community, members of the staff, and especially our parents, which is the majority of what the SHAC is made of. They help us make sure that we instill community values in what we put forth into these materials. If it happens to be something of instruction, or it happens to be maybe a service that we look at in the community to be able to provide for our school district. The school district also needs to consider your recommendation on things before we make decisions on health education, curriculum, and instruction. So what exactly does that mean? I'll dive into it for just a second. There are some governing documents that you can look at, and I would encourage you, we don't have all of that for you because some of that is really thick to print, right? But you can access it online, and we also want to make sure we're current, because we could print a certain version of a Texas Education Code and then it gets updated throughout some update. So what really governs us is the Texas Education Code 28004 that is then interpreted by our district policy, our legal policy, and then the local policy. So there's the State Board of Education, that education code that tells us what to look at, and then we look at how our school board then wants us to then in turn be able to offer recommendations or what they want us to work on. We also are governed by the SHAC bylaws, and those were revisited this past spring semester, and those are linked there, and I think there's a copy of them for you in your packet. I'm looking at you're referencing that. And then there's 2 helpful resources that are available for you, and those are linked in here. And there's a difference between what governs us and a difference between a resource, right? So there's something called the Texas Department of State Health Services, and it's a SHAC guide. So it basically is like, hey, if you're starting a SHAC, you know, these are some great helpful things to look at to be able to move things forward. Some of our meeting protocols, the way the agenda is formatted, the way that you have these PowerPoints that go on forth, the way that you receive the email from Dr. Merle with things in advance. Those are all protocols that that guide has helped us say to be transparent, send things out ahead of time, so on and so forth. And then there's something called the SHAC FAQs. This is the governance from our Texas Education Agency. It basically takes the education code and says, here are the how-tos in the SHAC. Does SHAC do this? SHAC does do that, so on, so on, and so forth. So I encourage you to look at those. And of course, I've linked that link just in case it does get revised. So the main components that the SHAC does, the number one thing that they do, one of the number one things that they do, is that they help us decide the hours of instruction to be provided in health education in kinder through grade 8, right? They help us decide what that might look like. And then we have a discussion whether the district requires health education for high school graduation. So we currently, in Conroe, do require the health class as part of our diploma, right? So alongside that, then that means with that comes other things that apply in these next 8 to 10 things. The number 2 thing that it does, you help us decide on policy, procedures, strategy, curriculum resources, if they're appropriate for grade levels or they're not appropriate for grade levels, on things like physical health concern, obesity, cardiovascular disease, type 2 diabetes, mental health concerns. We did a great thing last year. We have a mental health toolkit that the SHAC helped us with our guidance and counseling department. We send updates every week. Like, it is very thorough and comprehensive, and that is some great highlight from last year's work. So you help us to design that with these components A through I, right? So like we said, health education, physical education and physical activity, what is considered rigorous physical activity, nutrition services, parental involvement, instruction on substance abuse, so on and so forth. So I do want to just point something out. I have it here with me. It's over here. I do think that sometimes when we do make decisions, I would urge us to, something that I probably will ask Mr. Merle to give you access to, is when we're supposed to have conversations of it's age appropriate or not, sometimes we as a district decide how things should be age appropriate or not just because we decide that that's what we should do in 4th grade or 5th grade or 6th grade. There's something called the Texas Essential Knowledge and Skills, and it tells you exactly at what age what should get introduced, right? If you're familiar when I'm looking in the room, and hopefully I'm not aging myself, but we had Smokey the Bear and McGruff, the crime dog. Do y'all remember? Yes. So at what age were you exposed to that? And if you didn't, then I am aging myself. I don't know what the modern thing is, but at certain age you started getting exposure to that. So it looks different in 3rd grade than it looks different for a high school freshman. Right, so I would say that when we do get across of making a decision, that we educate ourselves as parents, because sometimes we might feel, well, a 6th grader shouldn't be exposed to that, but the state of Texas says we have to expose them to it. So how we expose them to it in the lesson is what you get to help us decide on, right? Because that is, we should be educating children on that, and at what level should we be educating children on that? So just wanted to point that out. For your reading pleasure, the font is a size 2, and it's I don't know how many pages, but it's just something that I think would be helpful as we make decisions as a group. What did I do, Mark? What did I do? What did I do, Dr. Earl? Go back, do you mind, Sarah? I think I'm on slide 3. There we go. So remember I talked about the age-appropriate grade levels methods of instruction for human sexuality instruction, right? So since we offer health education in our school district, one of the things that we talked about with SHAC was the letters of what that looked like. We have to have parent permission. That actually was something that expired from the current past legislation this August, but the SHAC decided to keep that as something that we have to do, so we have kept it as a recommendation. The board did vote on that. But it goes back to at what level do we start introducing what, right? So I know there was a question, for us before as we worked through some of the curriculum in the past, not necessarily about human sexuality instruction, which is the Health 1 class, but dating and relationships. Well, that starts at a certain grade level. So those are the kind of things that I would encourage us to know when is it that we have conversations about that. Number 4, you as a council also help us make any policy recommendation to the district concerning the importance of daily recess for elementary school students, right? We visited that. I'm going to look at Dr. Winkler about 4 years ago. Oh my goodness, yes, the years fly. Yes, McGruff, 6 or 7 years. It felt like 3 or 4. So 6 or 7 years ago on what we looked at research with our parents and our teachers and said, well, what is appropriate, right? And what do we do when it's too hot to be outside, right? What do we do for our kids to get them up and active? Strategies for implementing curriculum components on, again, like we talked about, we've already been through the health and physical health services, but the mental health services, when do we start talking about body image, self-worth, relationships, how we see ourselves with our peer, how we interact, how do we do conflict? All those things are things that you could assist us with. The comprehensive school counseling program, remember we talked about the mental health toolkit? That helps us, all that information helped us not only help information for the parents, but how to get things into our schools so that our counselors could be helping our kids. A safe and healthy school environment, right? We know that teachers, students can't learn if they're hungry, and they can't learn if they don't feel safe, right? So how do we help promote that? And then our school employee wellness, right? Our teachers will love on our kids when they feel valued, seen, and heard. Just like our kids will learn from teachers that they feel valued, seen, and heard from. So that's part of us helping kind of give district that guidance. We also help strategies to increase parent awareness regarding risky behaviors or early warning signs of suicide. That has been one of the topics that the board has asked for us to really focus on. I'm going to leave that up to our experts that are in the room as we move forward to talk about something that is something we all want to be better at, right? Available community programs. I'll give you an example. This past year, we were looking at some AED defibrillators to put in schools. There was a subcommittee that's required by the SHAC. They worked with an entity to get some of those donated into our schools. Our parents helped us do that. Like that were on the SHAC. I think those are great things that we want to know. We want to help to implement. We've already talked about appropriate grade level curriculum. So what is probably one of the hardest things to talk about is number 8, the child abuse, family violence, dating violence, sex trafficking. All those things are things that you help us make sure that when it's delivered to our students, it's something that is appropriate, it's relevant, and it's timely, and it's for the right age, for the right kid, and through the parent side to make sure that it's something that can be followed up at home and talked about. So that really is basically what the SHAC does. It does a lot of things. It, in a nutshell, keeps our kids healthy, and it keeps them safe, and it keeps them active. So you help us with all those decisions to recommend to the board to implement. The last thing that I was supposed to just talk about was the SHAC bylaws that are there with you. They have been revised. I'm going to say it wrong. April, May, I think. I'm not quite sure, but they have been revised. You have a copy of those. If you have any questions on those, you are more than welcome to reach out to Dr. Merle or myself to kind of walk you through some of those processes. And another thing is really the SHAC meeting protocols. We will present things to you that we think are relevant, but part of the agenda and the protocol that we have delivered and put into our meetings has been recommended by the guidance document that I shared earlier that's a resource. But at the end of every agenda are things that you want to talk about and make relevant, right? Because we need to hear from you on, you were chosen to be part of this so that we can make sure that we know what we're doing that's right for our community and what our community is seeing that we need to discuss or possibly recommend on. Am I good? Yes? Awesome. Thank you. I appreciate it.
Okay. So we're hopefully getting closer to where we're not going to talk as much and y'all are getting to do a little bit more. But the first item, official item on our agenda is we have 2 positions, parent officers to elect. We have a co-chair and a secretary. These positions are open only to the parent representatives, but the whole voting membership actually votes on those selections. So at this time, I guess we'll take, you can self-nominate or nominate somebody else. If somebody has, especially the secretary is great at taking notes and willing to type them up, that's the key to that. That's usually the harder one to fill. If you're depending on me taking accurate notes, we're in trouble. So, or I can take good notes, you just can't read them. But so the floor is now open for anybody for co-chair. Not everybody at once. Co-chair ends up working with myself and setting the agenda and actually running the meetings. So then, like this setup is on purpose because of an activity that we're going to do today with the wellness plan, but we'll have different setups depending on what the meeting is covering and what we need to accomplish and what's best to work for the group. But they'll help do that. There's a report at the end of the year that we'll work on together. Collecting information, making sure that what is the priority for the SHAC is being represented in the agenda. All right, Holly. All right. So Holly Moore. All right, thank you. Anybody else? Okay, do we have a motion? We have a motion to approve Holly. We have a second by Ron. Any discussion? All in favor, raise your hand. Opposed? Motion carries. Thank you very much. All right, now the all-important secretary. Any volunteers? Just do everything, Holly.
I'll volunteer for secretary.
All right. So Ryan and volunteers for secretary. Okay.
I've got my computer, so I'll just work on it.
All right. So he'll do them as we go. All right. Do we have a motion? Second is... Any discussion? All in favor, raise your hand. Opposed? Motion carries. All right, look at that. We're all going forward here. So our next item is approval of minutes. This is hard unless you were on SHAC for the last meeting on June 11th. The meeting minutes were sent out ahead of time. Do we have any corrections, deletions, comments on the minutes? Anybody that was here or I think it was a pretty good representation. Dr. Spear and I worked on those together to make sure that they were right. So do we have a motion to approve the minutes? All right, we have a motion.
I'll second.
A second. Ron? Any discussion? All in favor, raise your hand. Opposed? Motion carries. Okay. Moving on, we have community feedback. So on the website, there is an opportunity for people to submit questions or information through the SHAC website and SHAC email. I checked this the other day, we had 7 emails. We had one regarding membership question. That membership, it was based off of the board members nominating their folks and Dr. Knoll nominating his. We had a maintenance custodial request, so that was forwarded. We had a wellness plan and a question about food activity as a punishment and reward. I believe a couple of people have responded to that one. We have a concern for a counselor. It was a reach out, so it was for the counselor. The counselor is about their child, and it was a counselor issue. The triennial assessment and smart snack issue was addressed as well. We had a cell phone concern. He's actually an idea. He wants them banned from all schools. No cell phones. And then we had an immunization question, which was forwarded back to the campus nurse as an appropriate place for that to respond. So those were our community feedback. Whoa. What happened there? Well, that was weird. Okay, here we go. So this is an item that was left over from last SHAC committee. And it is consideration of House Bill 3908, which is called Tucker's Law, and it's a curriculum. And I'm going to let Lindsay come up here and kind of talk a little bit about Tucker's Law, what it did, what that information was. But to kind of give you information, at one meeting we approved the resources but not the curriculum. And then the curriculum was in the works. Everybody in the past committee had the opportunity to start reviewing it. But we never got to a vote that we approved the curriculum for what it's done. So, Lindsay?
All right, hi, I'm Lindsay Taylor. I'm the mental health specialist. I'm under the guidance and counseling department. So when you look at Tucker's Law, it is education that is done annually for grades 6 through 12, and it really does encompass 4 main topics. One of those being suicide prevention, prevention of the abuse of and addiction of fentanyl, awareness of local school and community resources, and any processes involved in accessing these resources, and health education that includes information about substance use and abuse, including youth substance use and abuse. So y'all were provided a list of the resources that encompass all 4 of these aspects. One of them is the suicide prevention. So September Suicide Prevention Awareness Month. We do have a toolkit that's tied into that. Our counselors receive that, our principals receive that, and it includes different information in it in regards to awareness on suicide prevention. We also have Conroe Cares lessons that help support. When you look at suicide prevention, it really is a foundational level of looking at problem-solving skills, managing conflict. There's a lot that goes into a foundation of suicide prevention. There's the awareness aspect of it, and then also supporting those skills. And so Conroe Cares, can you hear me? I feel like I feel like I got really quiet. So part of, when we look at the suicide prevention aspect of it, it's the awareness component, but also supporting those skills and the education for our students. We use Are You OK in our secondary level as well as with the 6th grade. That would be tied into the fentanyl curriculum, which I'll talk about here in just a second. Does anyone have any questions real quick about the suicide prevention aspect of it? Okay, so that brings me to the fentanyl component of Tucker's Law. So we did look at the CATCH program for fentanyl education for our kids in grades 6 through 12. Last year, there were concerns about slide 8 for our 6th graders because it does talk about explicitly like warning signs for suicide. And one of the statements on the slide is talk of killing themselves. And so they were concerned, you know, about the terminology or verbiage used there. So we did discuss supplementing that slide 8 with the Are You OK presentation, which really talks about kind of being mindful, being aware of, you know, watching out for friends, noticing any differences, reaching out and asking them for help, and then also reaching out to an adult and seeking support. And so we looked at some, omitting slide 8 and then replacing it with Are You OK? For grades 7 through 12, it would just be that whole presentation as part of the education piece for fentanyl. So, does anyone have any questions on the fentanyl side?
Has the district started collecting data around fentanyl, I guess, known issues?
That's something that we don't, like a lot of the things is, like I'm not aware of any incidents of fentanyl. I do know the county tracks that information though.
This came from
yeah.
Everton School or use or anything like that?
Yeah. Anyone else have any other questions? Oh, yes.
Fortunately, we've seen very little fentanyl in our schools. There have been a few cases where narcotics were taken off of someone and it had fentanyl within it, very, very trace amounts. But as far as us finding that on a regular basis, absolutely not. Very, very little within our schools, but it is in the community. And if it's in the community, it could be found on our campuses. If that helps.
And so with this fentanyl education piece, it just really, I don't know if y'all got a chance to look at it, but it really is fact-based. It talks a little bit about statistics. It talks about the lethal dose amount of fentanyl, which could barely fit on, or it fits on the tip of a pencil. And so all of the presentation really encompasses all 4 of the components. It talks about Narcan or naloxone. So does anyone else have any questions about the suicide? Yes.
Yes, each campus clinic has several kits of naloxone. We also have them in our athletic trainers' offices. We have them in our police offices, in our secondary campuses, and so we're well stocked with naloxone.
And with the suicide prevention, I know I talked a little bit about Conroe Cares and those skills, but it's not kind of a one and done thing when we look at prevention and intervention. That is an ongoing thing for our campuses. Does anyone else have any other questions? Okay.
Great, thank you, Lindsay. So hopefully that gave you information. Hopefully you had the opportunity to look at the curriculum. It is met the criteria that's set out by the SHAC last year. And so now we want to go ahead and send that forward if that's possible. Do we have a motion?
I'll motion.
So we have a motion for Ryan. Thank you. A second? a second, Janice. Any discussion about the curriculum, what it does, or any questions? Okay, all in favor, raise your hand. Opposed? All right.
Dr. Merle, if I can just add something for clarity. I'm back here. I just wanted to make you aware, because we did make a decision about 6th grade curriculum, and I think it's important as parents. You know, Ms. Taylor had referenced about suicide at 6th grade and that concept. So in 6th grade, our Texas Essential Knowledge and Skills require us to discuss the suicide risk and success protective factors as identified by the CDC and prevention, and the importance of telling parents or other trusted adults if one observes the warning signs in self and others. We are required to talk about explaining the role of health self-concepts in avoiding self-harming behaviors that occur when someone is struggling to manage overwhelming emotions. And we are required to help identify suicide prevention resources such as National Suicide Prevention Hotline. I just want to make sure that you're knowledgeable as parents on our committee, that when you do reflect on the resource that you see, because you're eligible to see it, obviously because you just voted for it, that you do know at 6th grade we do have to talk about those hard concepts, right? How we talk to them, at what level. I wanted you to know what level. So it is a level of awareness. Thank you.
Okay, thank you. The next thing, I'm going to kind of skip an order here and save the wellness plan for the end. But we have our subcommittees that we'll be putting together. And if you're interested in one of these two committees, or if you have an idea for another committee, we definitely can entertain that. But the first committee that is created and required is physical activity and fitness. And then our board selected an emphasis this year on suicide prevention, awareness, and education. As it was just talked about, did a great job of having a suicide toolkit put out there, and it was a lot of information and great tool to have on campuses. What was talked about at the board meeting is taking that and what else can we do to help decrease suicide in our area and promote positive mental health. And so that is what they're trying, that's what the board asked us to do, was to really look at suicide prevention, awareness, and education. How can we improve that as we go? So that will be another committee. So the kind of the plan of your homework is to kind of think about those things, think about what we can do. If you have another idea out there, please send that to me. If you want to, we can all be on both committees and do it as a group since we're small. If we want to split out, we can do that as well. But please think about that and start coming up with ideas and suggestions that we can put on the agenda for January. So the next plan is to look at our wellness plan. The very first wellness, so give you a little past history, there's a wellness plan that's online. It is not a comprehensive plan, it's kind of an overview plan. The reason for that is it was the very first one, and it was due to go out there as COVID was going on. And our focus and our goal during COVID was to get kids at school and keep them healthy and conduct school and not close school. And we did that very successfully thanks to Barbara Robertson, our lead nurse, and her leadership had a lot to do with us being successful during that time period. A wellness plan is looked at every 3 years, is what you're required to by the law. And so we did a triennial assessment at the end of last year, and with that data, and then an evaluation also of our plan, we use that data to start creating a new document that is more comprehensive. So the document that was sent out to you is a lot more comprehensive than previous, using the data and information. The document you have is just a recommendation. It was developed with the leadership of Barbara Robertson, and then we had also Robin Hughes, our child nutrition. Sorry, I'll get it out in a second. Child nutrition, and then Wade Haymart for our PE and health and looking at that. So the four of us worked on that document to put it together to give ideas and suggestions and kind of a formal format to put it in. But it is open for additions, deletions, edits, and whatever we need to do. So our goal today is to work on this in groups. Let's see. In 4 groups. We have our 4 groups. We just need to make sure that all the good ideas and suggestions are written down and then end up either handing me a document or emailing me later a document for each group to make sure that we're on target. So our goal is a solid rough draft after this. So the goal is once we do this process, then we'll have everybody's feedback. Then I'll compile that into a new document, a new rough draft, and then our rest of October and November, I will send that back out to the committee to review and give individual feedback on that to come up with a final document to bring to SHAC in January for final review and approval. Does that make sense? So, and then whether it goes to the January board or February board, I can't remember when the SHAC meeting was. I wanted to say it was early January, but I don't remember. But it'll probably end up being February before it'll go to the board. We're not on a time constraint, which is good. So if we have to delay that, we can. We just need to get something put into place so we can then start communicating that to our campuses and our teachers and then into students' hands. So this is what we're going to do, and we're going to have Dr. Todd's table here is going to be table 1. Dr. O'Neill's table back there is going to be table group 2. We have Holly's group that is going to be group 3, and we have Ryan's group that's going to be group 4. There are the goals that y'all are going to discuss. So it's kind of balanced. Each goal has some objectives and activities for those goals. And so the goal is to go through that and look at each one of those. And we're going to spend about 20 minutes doing that. And we're going to be walking around the 4 people that kind of put this document together to answer questions, to help, and all of that. So you know where this is coming from. In board policy, there are 13 goals that are listed in board policy, local. And these are the 13 goals that are listed in board policy. So we are required by policy to have those 13 goals. Can we add other goals? Yes, we can, but we can't remove any. And we can add objectives, or we can add activities if we think we need to, or we can eliminate objectives or activities if we need to as well. Okay? Yes, sir.
Is the number of goals that are in the policy based on state and federal requirements, or?
The 13 goals, and a good question, because it's a local policy, so it's developed locally by the board. So the board, as they went into it, determined that those were the goals.
My first thought was that there's too many goals.
Well, we all agree, and that may be something we want to address, maybe not with this plan, but as we go forward, and asking the board to revisit those goals at a future time to reduce the number of goals. We don't disagree, but when you look at an ideal plan, so we have a system we use, it's called WellSat. And what you do is you evaluate your plan to see if it meets a typical high school plan or school plan of what they feel is idealistic. Okay, so it's an idealistic plan. It's not reality, but it is what they consider the ideal plan. So what we're trying to do is also, and the goals are very similar to that, of coming up with a plan that helps meet all of the requirements from an idealistic viewpoint. We don't have to focus or target on those things, so you might see one objective or one activity related to one of those items, but in the whole scheme of things, it may not be our priority. Our priorities are probably going to be an objective, a goal and an objective that has multiple activities because it brings more physical activity, more healthy eating concepts or something like that that we felt was important based off of the feedback. And hold on, Barbara has something to say for us.
If I can give a little bit of clarity about what the wellness plan has to do, FFA legal and FFA local are because we participate in the free and reduced lunch program. And because we do, we're required to have these policies and we're required to have this wellness plan. So when you look at the goals are talking about healthy eating and activity and not, for instance, mental health, because that's not what the wellness plan is for. The wellness plan is to meet the regulations set out by the federal government and the USDA because we participate in the free and reduced lunch program. So that's what those are. If you look at FFA legal and FFA local, you will see some of these goals are referenced there that are required to be in your wellness plan and addressed. So that will help you a little bit. And you can find those policies online through the CISD website. And it's FFA legal and FFA local. But we are here to help you, guide you through some of these things. Are some of the goals long? Yes. But that doesn't mean we have to have lots of objectives to meet that goal. So we just want to be able to help you in getting to the final product. No. So the WellSat is through the Rudd Foundation, and so there are two different ways that districts can measure themselves against what the policy says is a model district policy, right? So that's, you have your school health index and you have your WellSat. So what you do is you look at your FFA legal, you look at your FFA local, and your wellness plan, and you enter those into their program, and it gives you a score back, right? And so some of our scores were 0 because we didn't mention at all carbonated beverages, for instance, right? And so we looked at what our WellSat score was, which is part of the triennial assessment, is to compare your wellness plan, wellness policy to that model plan. And so we did that, as that's a part of the federal requirements that you do. And so we looked at what did we get zeros on, and can we implement this some way through an objective without adding 25 more goals, right? So how can we get there? We're not going to get there, and no one's there that you're going to have 2s on everything. Some things we don't have school gardens. It'd be great, but we don't have school gardens in 65 schools. And so those are some of the things that we tried to add back in. So as you work through that, we're here to help you and look through, how can we get to the best plan that we can for our community and for our students. For the WellSat, I believe it was posted on our website. I'll have to check with Dr. Merle, but that was part of the triennial assessment. Okay. Yes. Mm-hmm. Okay.
Okay, first of all, I know that the tough part of all of this is to remember to use the mic if you do speak, so we can capture it. I know it's every time we meet, it's a contest. The WellSat is not posted on the website, but that is something I can get to the information to you, so you can look at the WellSat and how it was scored and how did it look to help in that final review part. So at this time, if y'all will start kind of discussing at your table things that you would like to see and what you would like to be part of the plan, and we'll move around and help and guide as we go. Okay, I'm going to interrupt real quick because I want to be respectful of everybody's time, and I appreciate everybody, really great discussions going on, but also want to be respectful of everybody's time. Change of plans a little bit is tomorrow I'm going, if it's okay, I'm going to send out an email with names and email addresses and who the groups were so that y'all can correspond by email and or Zoom or Teams or whatever. And if we can, try to finish this up by the end of next week, working as a group and getting those changes to me, and then I will turn that back around within a week and get it back out to everybody to then look at all the changes, and I'll have the changes in a different color so everybody can easily see what the changes were and what was added. The way everybody's going, and it's great, we'd be here all night. It's a pretty big task, I know, and we may have to come back in January and do more. So does that work for everybody? Is everybody good with that? Looked like I had a bunch of nods at the beginning. So the next item was communication with SHAC. And as I said, I'll send out that email so you'll be able to communicate with everybody that's on SHAC and share any information. We just ask that you do that to the group so we all know what's going on and we know what to expect when we come into a meeting. And the last item before we close out, are there any future agenda items that anybody would like to have on the agenda?
Could someone help me understand the role of SHAC with technology in the district?
So from a health standpoint, so it's kind of like SHAC initiated last year the cell phone question. Then we put an independent committee together to look at the cell phone.
I was on that committee, yeah.
I'm a proud member of it. So then we looked at the cell phones through that process. So it depends on what the question is whether we deal with it or whether we create an independent group. But technology, certain aspects of technology, and definitely student health and things that involve student health would be in play. Yes, sir.
One thing that I've heard from other parents, and I have the same concern myself with a high schooler, is could we revisit the cell phone policy? Is that something that would be available to us? There have been a few, there have been some studies and some other research done on cell phones, and it's interesting that places are trying new things since that cell phone policy has been put in place. They're actually working really well. Like they are, removing teachers' discretion on using the cell phones in the classroom. They're essentially saying you cannot use it, which empowers parents to have the phone turned off during the school day. Because right now, as a high schooler, parent of a high schooler, it's hard for me to turn my kid's cell phone off because 3 of his teachers use cell phones in the classroom. And so there's tweaks to it that could have profound impacts on a cell phone in the environment that may not have been thought about the first time around.
Okay.
And I'm not necessarily saying open it all up, to rewrite, but maybe adding certain items.
That's something we can definitely review as a group and look at. Any other items right now? If you have any other items in between or would like to see anything on the agenda, feel free to email Holly or myself as we'll be creating that agenda. Yes, ma'am.
I'll get used to this. Sorry, guys.
I know, it's
I'm also subbing for my husband, so I'm just going to complain and then I'll be gone. But the type of exercise that is provided for our kids, and what I mean by that is PE exercises, and then when they're at recess, if we could have structure or extra items available for them to actually exercise instead of sitting or, yes. More kickballs, footballs, yes.
Well, it's part of that committee of the physical health and activity. So, all right, there we go. Great, fantastic. Well, I want to thank everybody for their time today and all the work that you've already started doing, and I look forward to great things coming from this group. At this time, it's time to adjourn. Do I have a motion to adjourn? Oh, Holly motion. Second?
I'll second.
And Ron second. And all in favor? I don't think anybody will disagree on that one. Thank you all very much. Y'all have a great evening and be careful going home. Hopefully it's not 2.5 hours like it was getting here.